when we speak about the rare disease day campaigns, usually we have multiple activities, and often we organize, not often, but yearly we organize a roundtable discussion policy event where we include the decision makers and also healthcare professionals, and we discuss about the important things for rare disease community. We have specialized educational webinars for students of pharmacy and students from medical faculty, and trying to engage as much as it is possible the patients to support the Rare Disease Day awareness campaigns. And when it comes to the engagement with healthcare professionals, there are multiple ways that we are doing that. First and foremost, on those panel discussions and roundtable discussions, we always invite healthcare professionals that we cooperate with, because it is important also to hear their insights regarding the situation with rare diseases in Serbia, and that is important for us when we are striving to make some policy changes. We organize continuous medical education courses together with healthcare professionals and for healthcare professionals from smaller cities, in order to raise the awareness about rare diseases among them, and also for them to understand how to manage rare diseases, who they need to approach if they find out that there are patients that are suspected for rare diseases, who is that person on the tertiary level who they need to send the patient to. We also participate in a few expert commissions where, besides healthcare professionals, we are representing the patient organizations, patient perspective, patient community. You can start with the next slide. The first, let's say, continuous medical education course that we started was a joint activity with the Institute for Molecular Genetics and Genetic Engineering. It started in 2017, and till now we had 5 CME courses that we held together. All of them we are trying to organize in different cities around Serbia, and especially for our course, it's usually we have 8 lectures about rare diseases, and we are covering the topics about the symptoms, the diagnosis, and the treatment for rare diseases. And you can say that the interest from the healthcare professionals is great, because they like to attend, especially going to some cities that maybe don't have that much opportunity to hear about rare diseases. And what is maybe even more important is that the CME course that we started this year, and that was on the initiative from Professor Čuturilo and Professor Ivana Novaković, our long-time colleagues, and I can say friends that are supporting rare disease communities for many years. They had an idea of organizing a huge continuous medical education, and that it will be specifically organized during the Rare Disease Day. And this year it was the first time. I hope that we will continue, where there were, I think, 14 speakers, experts, 99 attendees, which is a really important number to see the huge interest among healthcare professionals to listen about rare diseases from our distinguished experts in rare diseases. The educational goals for this course were to introduce the possibilities of molecular and genetic diagnostic for rare diseases, also to introduce the modern therapeutic modalities for rare diseases, to hear what are the symptomatology of rare diseases, and how to treat patients with rare diseases. And I'm sure that Professor Čuturilo will maybe say something more about this at the end of the presentation. The other way how we include healthcare professionals is on those roundtable discussions that we organize. Every year around Rare Disease Day, we try to organize a roundtable discussion. The roundtable discussion has a specific topic. Every year it's something that is important for us to discuss on that year with decision makers and also with healthcare professionals in order to try to influence the policy changes or to assess what is the situation at that moment about a certain topic. Here you can see what are the topics. So we were discussing about the budget for rare diseases. We have a specific budget that's treating rare diseases, the importance of the newborn screening, access to medicine. So we try to cover all those important topics when we organize those roundtable discussions. At the end, what are some of the outcomes and what is the impact of our cooperation with healthcare professionals? Through those continuous medical education courses, we improve healthcare professionals' ability to recognize rare disease symptoms that leads to faster and more accurate diagnosis. When we are cooperating together in those expert commissions, by doing that, we provide our input to key policy changes, and we also try to cooperate with healthcare professionals in order to build a network of specialists that are knowledgeable in rare diseases, because we know that it's important to have a cooperation with someone, and we know that we have a lack of specialists knowledgeable about rare diseases. So it is important to have a closer cooperation with those healthcare professionals. And we also like to include them in our policy activities, because it is, let's say, from one side, we have a patient perspective, and we know from the patient perspective side what is important for patients and what we want to achieve. But it is important to listen to perspective from healthcare professionals. Then only when we joined our perspectives that are maybe different, and we know what is good and what is bad from both of the views, then we can achieve what is most important for the patients, and to have to join forces and strive for the policy changes to better diagnosis for rare diseases, to better access to therapies and all.